Everyone. Good afternoon to those for our Western colleagues, and good evening to our Eastern colleagues. And welcome to the last of this four-part series on smallholder pigs that we've been putting on here through WECAN and CAS. Very excited to wrap this up, and Sue has informed us that this is the pièce de résistance, as she said. So a really exciting way to end up. This series was made possible thanks to Sustainable Canadian Agricultural Partnership funding, and they do have a survey which I'll put at the end of these slides, as well as we'll put it at the end of the session. And I know not many of us really like to fill out surveys, but we really would like as many people as possible to scan that QR code and fill in the survey. We will also be sending it out with the end of session summary later on. Your two MCs for today. So for those of you who don't know me, I'm not Doris, obviously. My name is Murray Gillies. Doris is on vacation. So I will be one of the MCs for today. I just joined CAS about 3 weeks ago as their new coordinator. And we also have the ever-present Dr. Barb Wilhelm from the Western Canadian Animal Health Network from Vermilion, Alberta. And so same housekeeping stuff. Please keep yourself muted during the session. You can ask questions either in the Q&A chat box, or you can unmute yourself at the end of the session and ask. For Race CE, the session is approved for 1.5 hours, and so there's 4 sessions. So if you attended all 4 sessions in person, you'll get 6 hours of race certified CE. These certificates will be sent out after the entire course has been delivered. So after this session, you should get your certificates within about 2 weeks. So wait about 2 weeks, and if you haven't got your CE certificates by then, you can email Doris at the email at the bottom of the slide here. The session is being recorded, as we have to do that for race, and anyone who misses the session live will be able to check out the recordings. However, only race CE will be provided to those who attended in person. And the course materials and everything will be sent via email. So as I stated, this session was made possible by the partnership between the Western Canadian Animal Health Network and the Canadian Animal Health Surveillance System. If you are interested in more about either of those networks, you can scan the QR codes on the slides here, or visit the websites at wecan.ca or cas.ca. And this was funded by SCAP. And so this is the QR code that I was talking about. We're very grateful to have the Sustainable Canadian Agriculture Partnership funding to provide these and other webinars that would be put on over the course of 2024. So if you are in the mood to scan the QR code now and pull up that survey, please do so. And again, I'll put the slide up at the end of the session to also fill out the survey. And we please highly encourage anyone to do that. So without further ado, I'll turn it over one last time to our resident swine specialist, Dr. Sue.
Thank you, Murray. Appreciate everything you guys have done to organize this. And I'm just going to, screen share here, find my little presentation. And so I'm sure everybody's so excited to talk about, or listen to me talk about pet pigs, which is always a lot of fun. I have to admit, I do less of them now than I used to, partly because a lot of my work was with a sanctuary, and that has now sort of disbanded and moved the pigs off. Get the odd pig, but still have some interest in them. And so this PowerPoint presentation is sort of a summary of my experiences with them over the years, and I'm sure there are those of you out there who are probably far more competent now than I am with pet pigs, just by virtue of seeing a lot of them coming into your clinics. So before we get started, a couple weeks back, there was some discussion about African swine fever and hemorrhages and blotching of pigs, and how would I know, and should I call CFIA? And so I wanted to quickly give you a case that I got called out on this morning. So these are like pretty freshly dead as of this AM. And this was a photo that was sent to me by the producer. And now this is not a smallholder. This is an 850 sow farrow to 25 kilo operation, and it has several sites for finishing. At any rate, they'd been struggling with, what have I got here? They had 3 dead sows on Sunday. He didn't really want to call me because it was Sunday, which I said, yeah, you could have called me. I didn't fine with that. And they had 2 dead this morning, but they also had 3 dead 3 weeks ago. 1 died and 2 recovered. And all these sows got super white. They've had a couple early farrowings last week. And then as I was there today, 1 was aborting. So everybody's, you know, on the heels of our ASF talk, I thought, wow, here's a great one to tell you that it wasn't ASF. It had nothing to do with it. So don't don't panic. This was pretty sensible kind of visit, but that is pretty remarkable venous pooling of blood on this the one sow on the left hand side. So I do have a history on this that also led me to know that it really wasn't going to be something for an animal. For first of all, nobody's been out of the country. Actually, I shouldn't say that. They have employees from Guatemala, and one has just returned back after spending 6 weeks with his family. But as far as I know, Guatemala does not have ASF. So I think that would be okay. This year, we've had a lot of problems with corn quality, a lot of corn shattering when it's being milled. And so there's a lot of really fine feed, like powder, like talcum powder almost, that you can get on this pig feed. And so here's a great lesson that sufficient fines in pig feed will provoke stomach ulceration. And so you can measure the size of feed particles if you're thinking you're having a problem. So basically anything under 600 microns, you're going to have issues. We like feed to be fine to a certain point because it's digested better, and certainly our grow finish pigs will grow that much better. But if you get too fine, you are asking for trouble. And the trouble is stomach ulceration. And so these sows were eating finer feed. They had a certain, what do they have? They had a, I can't remember the size of the screen. It's gone from my head right now. 5/16, 3/16, it's gone now. I've got the notes somewhere. Can't think. At any rate, they changed to a coarser screen, and they're also adding wheat. And they did this 3 weeks ago, where they had measured particle size and changed the screen size. And so why, you ask yourself, was a pig on the right still white and dying of bleeding out? When I autopsied her, her stomach was full of blood, her small intestine was full of blood, her large intestine was full of digested blood, and she had bled out. And I think this was just simply these pigs were on the edge, although they didn't look like it. It's a beautifully run barn. Everybody's very zen, but probably the stress of farrowing, because all of the dead sows, other than 1, came out of the farrowing room within a week to 10 days of farrowing. The pig on the left had nothing to do at all with the pig on the right. The pig on the left, I cut open, and there was certainly a very large, red, ugly looking lung, full of blood and edema, but the spleen was regular sized. I did take a spleen sample, I'll be happy to know, for the ASF monitoring CanSpot. So I did my duty. It went out today. But the lung was very red. And then as I examined the heart, this is a classic in swine, and actually there's been some work published on this where I believe this pig died of cardiomyopathy. There was a very dilated right ventricle, very floppy. And that would make sense, because then the blood would back up in the lung because it couldn't get into the right ventricle, and, would back up because the right ventricle was dysfunctional. And so I took some heart samples, I threw some lung in there, but this definitely is not an ASF case. But I just thought it was quite interesting. So to lighten everybody up, I love really good cartoons and memes, and here's a good pig one. Best tattoo ever. Back to the topic of note. So let's go into pet pigs. I realized that I hadn't really put a history in last year. So I stole this from one of my other slide decks where I was talking about pet pigs. And these pigs go back, they reach back, potbelly pigs, about 6,000 years, kept as pets for emperors' children in China. In Vietnam, they're also kept as pets and as mobile garbage units for food scraps, and then they are food themselves when times get tough. And obviously the poop is used to fertilize gardens. And so those who did their tour of duty in Vietnam reported seeing these pigs in villages. And they don't quite look like the ones that you're seeing out here in North America. They're quite a bit different, especially the one on the right, this huge swayback on this, probably an older sow. So they were imported to zoos. They were a novelty, and they were brought into the United States somewhere in the 60s. And about the mid 80s, Keith Cannell imported some breeder pigs into Canada. And they're really going to send their progeny to zoos, but then the public became aware and became clamoring for them as pets. And so these pigs average at that time about 60 to 80 kilos. And then there were the miniatures were established afterwards for pigs less than 15 inches tall and obviously not as heavy. Everybody went crazy. It's like a fad. I've been through the emu fad, the ostrich fad, the sugar glider fad, the potbelly pig fad, you name it. It's a human thing. We love fads. So these pigs way back in the 80s were like $2,500, which be the same as, I don't know, money's inflated so much, let's say, $12,000 today. And depending on the ebb and flow of the economics of potbelly pigs, sometimes they're free and sometimes they're not. Then somebody got the bright idea to market them as teacup pigs. And this slide actually I had from 2019, but I said, and onwards, because you still see teacup pigs out there. They come with a big price tag. For $2,500. You can buy a mini version perfect for city dwelling. Good luck with that. Because just because they're small and cute and bet you $1 million these little pigs are about a week old, they're looking really cute. They're sitting in a teacup and they're probably going to grow up to be 60 to 80 kilos. There are not just potbelly pigs. I'm going to really be referencing the potbelly pig, but we have also the Juliana pig, which is the pig in the bottom. Nice little spotted pig. They are small. So they do stay small. And then to the right, we have Kuni Kuni. We saw them as a heritage breed, which can be raised for meat, but the smaller ones are often kept as pets as well. And they may have wattles, which you see on this pig. Those little things hanging down there are wattles. Kuni Kuni is actually, they're from New Zealand originally. I didn't know this till I looked it up today. And Kuni Kuni is Maori for round and fat. So there you go. Why am I showing you a large black pig from England? Because they are large and they're black. And so creative people either mingled these pigs or more than likely had black pigs and sold them purporting to be pot-bellied. And then I would get phone calls about, why do I have a 400-pound pot-belly pig? And I'd say, because you don't have a pot-belly pig. You got sold a pig. It's human marketing. I just love it when this happens. They're omnivorous, as all pigs are. They love to eat. They will form alliances for the family pets to the advantage of both. Your cupboards are never the same. Anybody with a pig in the house knows that everything's locked because, and I will talk about this at the end of this, pigs have an exquisite sense of smell. Think of truffle hunters. So they can hunt for anything you want hidden in your cupboards. The pig might get the cupboard open or the dog, and then they will destroy and eat everything that they find. They're generally friendly, especially if they're spayed or neutered. And as they age, which a lot of people don't realize, they tend to sleep more. And they may sleep as much as cats. In fact, even our commercial domestic swine, they'll probably snooze for up to 22 hours a day. So if people are getting smaller pigs hoping to have tremendous fun with them, and some are busier than others and they will sleep less, but they just tend to sleep. So, classically couch pigs, next weekend or this coming weekend with the Super Bowl, this is your ideal couch mate because they ain't moving. They're on there watching TV with you. This is a very large potbelly pig, so I suspect if we did a 23andMe on it, there would be something in the background that wasn't all Vietnamese potbelly. And but this pig, I thought that was kind of cool, scared away the burglars. I can't imagine why. But coming in through the front door and looking at this, because they're also territorial, they don't really take kindly to intruders. Some pigs don't take kindly to visitors, and so have to be either tucked away or put in a crate or whatever. I'm not going to go show you this slide. You can look this up, or sorry, it's a video, because I'm going to run out of time, and I already know this because I added a whole bunch of slides to this talk. Basically, it's a Massachusetts couple. This is from a few years ago. Were attacked by their own potbelly pig, and so I got intrigued and I followed through on it. And this is, again, people not understanding. This would be a smallholder. They were going to raise potbelly pigs, and they had done so. And this was their boar. They had 2 sows. The primary word in this conversation is boar. This is an intact pig. Intact boars are unpredictable. I don't care if they weigh 40 kilos, 20 kilos, or 400 kilos. They're unpredictable. They had 2 sows in heat. He was going in to breed. They wanted to separate. He attacked the wife initially. She went to the hospital. Her husband came home. He thought he'd try and get him out of the breeding shed, and he got attacked and hospitalized as well. And the boar was euthanized. So need to remember that, which is why we spay and neuter. Basic facts. Another thing people don't realize, they live up to 18 years of age. Yep, 18 to 20 actually. But 12 to 18 is a nice, sort of reasonable, normal curve of a lifespan. As I said, the weight varies. I've just seen an awful lot of potbelly pigs that were probably closer to the 100 kilo plus. And it depends on which breed you're dealing with. Rectal temperature, you can get that. Heart rate, good luck with that. They're usually screaming. And respiratory rate, about the same thing. You can't hear much because they're usually screaming if you're trying to examine them. And I'm not trying to be sarcastic, it's the truth. I do strongly recommend feeding a diet that's designed for potbelly pigs. We'll get into this later on, but certainly for the reason of it's balanced for the size of pig. I mean, if they're trying to feed them commercial pig diets, people usually pick the wrong one. They'll get a grower diet or even a nursery diet, and they're higher in protein, and so you just wind up making this enormous fat pig. You can feed a commercial grower diet, not a nursery diet, to young pigs, but I would suggest just these pig feeds are easily located, and those would be the better things to feed them. Supplement with fresh fruits and vegetables, because pigs they thrive best they are happiest when their stomachs are full. They like to have satiety, so having things to chew on during the day that will fill those guts are good, that are not high in calories. As a rule, half a cup of adult feed per 10 kilos. It depends who you're reading. Christy Mazzacchio in her book, I referred to that before, and I'll show you a picture at the end on the potbelly pig. You can buy the rule of thumb 1 to 3% of body weight per day, a free choice for the little guys, and then you gradually taper them down until they're at maintenance. Yes, at only 3 months of age. They grow fast. The only problem I really run into with potbellies, if they're not in the house, are the potbellies that are or pet pigs that are in the barn. And when I say pet pigs now, I'm referring to the smaller ones, the Julianas and whatnot. Earlier in my career, frequently people forgot that these pigs are tropical or semi-tropical. They're from, the Vietnamese potbelly pigs from Vietnam. So they're not designed to survive in cold weather as in the wild boars or our feral pigs are. So if they're going to be living in a barn, you do have to increase their feed intake in the winter time or in the colder weather, to allow for the metabolic need to produce heat to stay warm. Also bedding them appropriately. I love this guy. I mean, this is a commercial pig in the middle, but it's great. All you see is this little head popping up, and the rest of the pig is buried in straw. Making a little like a dog house with a heat lamp hanging sufficiently high that the pig can't access it, and filling it full of straw is another way to keep these pigs warm in the wintertime. But yeah, just have to remember that. And there is up in the upper left, you can barely see it, and it's the best photo I have. I don't know what I did with the rest of them in that series, but this was on my potbelly pig sanctuary. This pig came in as a rescue and promptly had a litter of 4 or 5 piglets. And so they had built a lovely little creep area. So it was a little like a mini dog house with a lot of shavings. They had a heat lamp in there, and these little guys are really cute. They have domed heads when they're small. They look like they're hydrocephalic. They're not. They're just cute. And also in the summertime, as much as we want to keep them warm in the winter, remember they do struggle with the heat because they don't have sweat glands. So provision of, if they're outside, you know, some kids' swimming pool is always great, and they'll go and sit in them and they'll cool off in the warmer weather and work with evaporative cooling that way. Vaccinations. Erysipelas leptoparvo combination, you can taper it down, and you know, I'm kind of by guess and by golly sometimes with that. But why those? Because if my potbelly pig is going outside, it's going to possibly encounter erysipelas. If they're in a barn, good chance they might get into some leptospirosis exposure just from rodents and urine and things. Parvovirus is more of it's a pig thing, but it's a combo vaccine and not a bad one to use. The Farasher B Gold is nice because it's only a 2 cc injection for domestic swine, so you can taper the dose down for smaller pigs, and you know, as in dogs and cats. I usually recommend 2 injections about a month apart for the small guys, and then yearly, which sometimes happens and sometimes doesn't, but at least get that initial one into them is a good idea. I use a 3-year rabies. Been asked before, which one do I use? I use the IMRAB, which used to actually be on the label many moons ago. When you guys were all puppies, it was licensed for use in swine, so I've kind of stuck with it for that. Tetanus, pigs are relatively resistant, so I don't vaccinate them, or I have not vaccinated them routinely for tetanus. And why is there a banana in this photo? Because you got to bribe that pig afterwards. They have really long memories, and they certainly will imprint your smell and associate that with an unpleasant vaccination experience. You know, you might roll a pig up into a burrito to vaccinate it or whatever, and they get super annoyed. And they certainly shriek about it too. So if you're going to have pigs to vaccinate at the clinic, put them in at the end of the day so they don't upset every other dog and cat that's sitting out in the waiting room. So I bribe them afterwards, and they'll moderately forgive you, but they have very long memories. Again, if you're going intramuscular into the neck, don't, even though these obviously are pet pigs, still don't put it in the hind end. I learned the hard way as a younger vet that they like to really bleed if you inject them in the hind end. They'll maybe bleed a little bit from the neck, but yeah, I don't use the hind end on them. It's just too vascular and just gets people really upset. So I had used this slide for a long time, and I realized that it was incorrect before, so I corrected it. We used to, before we eradicated pseudorabies in the States, we had to blood test swine that were coming into Canada for brucellosis and pseudorabies. But now, if you're going to take your pig to the States, you need to, and it's still considered domestic livestock. It is not considered a pet. So you need to have a certificate filled out from CFIA. So it's the HFA certificate for the US. You can get a current one from your local district office. And I use a lot of these pigs are microchipped, or you can microchip them. And that's acceptable to put on as an identification for the pig on that certificate, just so you know. And the pig, when it returns, has to be quarantined, which is a no-brainer because it just goes home and it lives there for 30 days. You just sort all that out with, well, the owner will sort that out with CFIA. So periodically, I do have people calling me. I have a couple of pigs that I see every year in the fall when their owners are going to Florida. They're driving down big rig and going to have a lovely winter. And the pig is going, and they struggle to find a veterinarian who can fill out the certificate, because you have to be an accredited veterinarian, of course, with CFIA in order to fill out the forms and sign them. So if you are accredited, get accredited for pigs, because if you're interested in pet pigs, you may be asked to endorse a certificate for them to go to the States. Okay, switching over to pet pig sedation. I took this from, let me see, some article I read. I thought that was really good. And it indicated a number of different combinations of products for use in pet pig sedation. Oh yeah, this is for castrating potbelly pigs. There you go. So you've got all kinds of permutations and combinations thereof. I think I told you guys that I'm pretty fond of the what do we got here? Ketamine and xylazine and combination, but you know, I'm old school, and so there's all kinds of things you can use here. Actually butorphanol, I use the triplet. But at the clinic, you'll have a little more variety of things to choose from. So you can work with what you find. You can decide what works for you and then choose that. Again, there's my deep sedation for short term. If I'm going to somebody's house, going to do a foot trim. I will tell you this, they must have fabulous levels of cortisol when they get lit, and as in you walk in the house and they get lit. Because I have learned this the hard way as well, and it's with the sanctuary. You know, you go to sedate a pig to do its feet, and they're just screaming and fussing and carrying on. And so you calculate everything out, and you give that pig an injection, and you sit and you have a visit with the owner while you're waiting for the pig to flop down so you can do its feet. And you might be there for an hour and a half, and that pig is still zipping around, just because it's overriding your sedative. They're really interesting what they can do. I have topped them up, and you want to be careful with that. You know, kind of over top them up the first time. I just sort of give them like a half dose more, and when they laid down really hard, and then you know, this is from experience. I'm just passing this on to you guys so you don't do the same thing I did. But the sanctuary owner called me and like, are they supposed to sleep for like 18 hours? And I said, no, they're just working off the sedative and they'll be okay. I mean, certainly you can reverse xylazine and metatonin, but yeah, make sure if you had to top them up that wherever they're going to rest, it's going to be warm and comfortable. You're not just sort of leaving them in the barn, because they certainly won't thermoregulate quite the same way as if they were awake. You can certainly go IV. The pig ear vein, I have been, and maybe it's just me. I mean, I can jugular bleed a pig like there's no tomorrow, left side, right side, upside down, you name it, I can do it. An ear vein on a potbelly pig it's an art. And I think it's one of the things I just haven't mastered well. Dr. Mazzacchio in her book demonstrates the cephalic vein that you can access, and she describes how to locate it. Or sorry, the radial vein. And I'm gonna tell you something. I have tried, but I think whatever pigs she's been working with definitely are in much leaner condition than the ones I've tried to find veins on, and have been remarkably frustrated by looking for it. But again, I think, you know, maybe it's my lack of experience therein. So she describes, there it is on the left-hand side, medial aspect of the forelimb of a miniature pig. And then she's showing, you know, there's these carpal glands, which sort of have a bit of a browny discharge. And then she's got a red circle that shows the accessory carpal bone. And then there's a groove in there you're supposed to find. And the you'll find the vein that way. And I'm like, yeah, it hasn't worked for me. So you can practice, you know, maybe and get, you know, it's a white pig. So I mean, and I think my great misfortune is all the pigs I've had to try and get blood out of have all been black. And maybe that's part of my problem. I can make all kinds of excuses. So you can use, you know, the auricular vein if the pig's coming in the clinic for procedures or, you know, a surgery, and you're looking for a venous accents. You like I said, the cephalic vein, radial vein, femoral artery and vein, saphenous veins. Maybe if they're white, I've looked for those and been relatively successful. And subcutaneous abdominal vein, meh, depends on the size of the pig. Don't mean to depress you with all this, but at least you have options, and that's the good news. So as I said, we may be sedating for the purposes of hoof trimming, and so you'll recognize these slides from before. I doubt we'll be doing piglets. It's going to be adult pigs. And so hoof trimmers, goat hoof trimmers or horse hoof nippers, a Dremel, metal file, or a rasp. You know, really, if you don't do a lot of hoof trimming on pigs, you can actually ask around, because there are people who will do professional hoof trimming for pet pigs, and life is a whole lot easier if they're going to do that instead of you. That's as far as I'm concerned. So, and we have had a couple. I used to refer people to from around here for their pet pigs, and they're very adept at what they do. So obviously, you know, we're going to be looking at, I think I have some photos here coming up of, you know, really long toes. And so you'll take the first cut back as sort of to a point where you're comfortable, and then, you know, start nipping away at the excess. Just don't sort of cut it back to where you think it should be, because you run the risk also of going too far and getting into some really bloody tissue. There's the photos I'm looking for. This is not unusual. You know, these pigs, especially if they're house pigs, they're not going to be wearing down their hooves, and they're just going to start curling up. Also, if the pig has a valgus deformation, they're not walking properly on the hoof and wearing it down either. And so you're just going to get these remarkably long hooves. And once you get, you know, them trimmed back the first time, and then kind of get on a maintenance program, it's a lot easier. The first time is probably your worst time. And if you get in the maintenance program, you may be able to eventually do this without sedating the pig. And I don't know, this isn't going to work. Let me go back here. Oh, there we are. Let's see if this, I'm not sure if you probably won't be able to hear anything. I'm not sure. But this is forking the pig. I want you to watch this. She's got a little scratcher, and this is just amazing. Look at this. So that's called forking the pig. It has nothing to do with eating the pig. You can watch this video afterwards. You can look it up. And then there's also a great video on trimming mini pigs' hooves. So instead of me telling you, you know, with a bunch of photographs and everybody's trying to figure out what I'm talking about, I think it's just better you go to the site that has the experts doing it. But even in large pigs, they do love having their back scratched. I don't know if you can make them fall over. It's kind of like, you know, hypnotizing chickens and stuff. I think it's kind of along that line. Probably doesn't work as well on big pigs, but on little pigs, and especially if people are aware of the value of getting them used to the fork and having them go over, and they can just be scratching their backs, and you can be trimming their feet, and it's a great experience for everyone. Okay. The pig flip is often used by people to, you sit the pig on its haunches, and then you kind of flip it back into your lap, and then you can try and trim its feet that way. These people on the right are professional farriers, and they have kind of like a little piggy box that they put them into, and then they restrain them, and then they can do their feet that way. The pig flip, you know, if the pig is reasonably sized, I mean, if you're looking at that 200-kilo, you know, Vietnamese potbelly pig, I suspect ain't nobody ever going to trim its feet because it's just too big. And who wants to flip it into their lap, because you'd never come out of it alive. So, you know, responsibly sized pig, you can flip backwards, or the owner can, and hold on to it, and then you can try and do its feet that way. You might want to try a couple of different techniques before you resort to sedating the pig. Pig sling is, and you could probably build one. This one here, I actually was curious and I looked up the price tag on it, and I think it's about $5,000. And it's like, don't do that many pigs. But you probably could, those of you that are creative, have a creative bend and can build things and refinish furniture, whatnot, you can probably build your own pig sling. And it's like anything else. Once their feet are off the ground, where are they going to go? Nowhere. So they might protest a bit, or they may just lie. They may just lie there, standing there, sort of hanging there, in this pig hammock, so to speak. And then you can see that's Christy there, and she can just grab those feet and work on them. And the pig really can't do too much. So it's another tool in the toolbox. Dental care is, so what are your common calls? It'll be hoof care, dental care, excuse me, and then vaccination and spaying and neutering. Probably I would say were kind of big on my list of common things that I did while I was doing more pig work, small pig work years ago. So these tusks do erupt about 5 to 7 months of age, and they'll whether it's a neutered pig or an intact boar or a females have shorter tusks on them, tend not to be too problematic. It's the males that will have the longer tusks. And when do you trim them? It depends on the pig. It depends on how fast they're growing. Certainly the risk to others. I have here generally done annually. I think it's just as you need to do the pig. And most male pigs, they don't really start growing them until they're about 18 months or later. And as I said, they grow in both intact and neutered males, which I wasn't sure about when I first started working with potbellies, and discovered, yep, they grow tusks. If you're going to be trimming the tusks, you are going to need probably anesthesia, and they should be done in the clinic, because it's years ago we were pretty unrefined, and we just sort of used our hoof nippers and trimmed off these tusks, and you really risk shattering the tooth, damaging the the tooth root, and obviously a long-term infection can start. So you want to bring them into the clinic and do them then. So let me see here. That's just a nice photo of, that might be a female pig because she's got smaller tusks. Tusk root abscesses, yes, they are a common issue in older males. They're pretty smelly. So again, it's something that should be done in clinic under an anesthetic. You don't take them down to the gum line when you're trimming them. You're using a high-speed drill or a Dremel, and you're taking them off carefully, and certainly check around the root or the bottom of the tooth at the gum line to make sure that it's looking pretty good. Flush it out, clean it, that sort of thing, because really it was very common for me to see tooth root abscesses in older pigs. This is, a sad photo, but it often happens with pigs that are kind of like living outside, kind of in the back 40, wandering up to eat. So this pig's tusk has, it's probably a malocclusion, because the bottom tusk will grow quite long. The top tooth here is really sort of a sharpening agent for that tusk, and they haven't really met up. And so this tusk has continued to grow until it's actually gone back into the cheek of this boar. And I think, who was I talking to? Somebody about Jacob sheep as well, with the multiple horns on their head. And, every once you get the one curls back and grows into the head. And you see the odd cow with the same thing. So make sure that, if you get into this situation, that, you get it dealt with pretty quickly, because this really cannot be that comfortable to deal with. And I have no idea how he manages to eat. There's a photograph of a pig under anesthetic, and he's having that tusk shortened again. You can see it's been done once before because it's got a flat top on it. Surgical procedures. So basically, I think I'm going to just talk my way through spays and neutering of pigs, again, done in clinic, even the neuters. you can, I mean, this is just you can do a propofol slow IV after you've sedated them. Or you got, ketamine diazepam, and then you're trying to intubate with that. You can just put a mask over them, get them down that way, and then intubate. But after, we'll go through all these different anesthetic protocols. But basically, remember, the pig should be fasted about 12 hours before surgery. Remove its water like 4 to 6 hours before surgery. Remember, they don't do well without water for long, so we don't need to make this an all-day affair. So, and I think 12 hours is fine for taking them off feed. They are, as I showed you in that case, pigs are prone to gastric ulceration. And it can start not just with feed that's too fine, but if a pig's been off feed for too long, they'll also develop gastric ulcers as early as 48 to 72 hours after being off feed. Probably not the case with the miniature pigs, a little hardier, but something to keep in mind. And so, certainly do a whole package deal. If they're coming in to spay or neuter, just take note of, do their feet need to be done, check their teeth, that sort of thing. And note to owner, and have them sign off, obviously, on that. So I've used inhalant only years ago because I'm a dinosaur, and I don't have a clinic per se where I bring pigs in. I used to rent the surgical facilities and the technicians from a very accommodating local clinic that was just great to work with, and enjoyed the pigs coming in, and they would actually do some of the pig work there, like vaccinations and whatnot. So we actually had a lot of fun. So, at any rate, years ago, I used to just use inhalant only. Certainly for neuters, it's not hard to do. And the recovery time was pretty fast, obviously afterwards when you turn them off. But why do you want to intubate? And we'll get to this as we're going through pyometras, older pigs, an obese pig, which is probably 90% of them, where you've really got a lot of jowls and pharyngeal fat and you're worried about airway obstruction. You can use a laryngoscope blade and a stylet. It'll work. And obviously the pig has to be in sternal recumbency. Sometimes it's a little bit of fussing, but you can get there and it's all good. So you can, certainly you can mask it down and then intubate if that's what you're doing, or you've used, a combination product to deeply sedate them and then you induce them and then intubate from there. So tracheal size is generally smaller than you think it will be. And I've got some suggestions as we go through. So have a variety of tubes available, just, depending on what you can fit into the pig. You're definitely going to have somebody holding the pig's mouth open, obviously. And just remember, pigs' jaws don't open as wide as a dog or cat's. They're pretty limited. And so it's a little trickier that way. And so the epiglottis is usually kind of behind the soft palate, it's a bit trapped there. And so you can unhook it using that stylet and then get that tube in there. There we go. So there's just some suggestions, 90-kilo pig, take a 9mm 7.5, just have a variety, go shopping, see what fits. But then anesthetize them and then you're good to go after that. So you can use, if you're going to just go with a face mask, large cone mask, but you've kind of got to tape the face seal around so they're not leaking, and especially if the pig is struggling at first. Some people with the larger pigs will use like a gallon plastic jug. You can kind of MacGyver stuff to make it work for you. Fairly high oxygen flow rate with 5%. You can pad things, wrap a towel around the junction of the mask and the face to help seal it. Watch the bag. You just you want to make sure that you've got stuff going in and out of that bag, and don't look at the chest. That doesn't tell you anything. Watch that bag, see what happens, and then you'll know obviously when they're starting to relax and induction is occurring. For pet pigs, we sure don't do farm castrations. I mean, maybe some owners who are breeding them are comfortable doing that themselves, but I always had them brought into the clinic around 3, 4, 6 weeks of age. These guys are mature at 3 months. And so, yeah, you can do them younger than you think you can do them. They're not young puppies or kittens. They're like ready to roll and, you know, steal cars and smoke cigarettes behind the barn and whatever when they're 3 months old. So get them done so we can get that boar behavior over with. The only thing, and I don't know if I've got a photo of it, it'll probably show up later. On a Vietnamese potbelly pig, especially, the testicles are held really close to the body wall. They're not sort of droopy or like dogs are, or cats. And so you almost think, do they have any? But they do. They're just really tight to the body wall at the back of the pig. So just make sure you palpate both of them, that you actually have 2 testicles, that you don't have a surprise that one's being retained. And I just, when I'm doing them, depending on where they're living, I actually just do a medium raphe incision and pop them one out at a time through that. Just sort of less cutting and irritation to the pig sort of thing. It's a standard, you know, you can do a closed or open castration. And if there is a retained testicle, we talked about this last week as well. Now these are pets, so we're not talking about leaving these guys to go off and living their life with one stuck inside, because that's not good. Always remove the retained testicle first and then do your other testicle. This is, so the bottom photo is that's definitely a potbelly pig, and it's also got a hernia, so that's, you know, needs to be repaired in there. But you can see there's a left hernia, and to the right is this like little tiny testicle, and that's what I'm talking about, being really close to the body wall. It's there and it'll be functional, so take it out. Hernias, definitely, you'll get, you know, if they have a hernia, you'll get called about it, and they'll be sufficiently small that you can probably successfully repair them. It's scrotal hernia is more heritable. It's sex linked. Obviously, if it's a scrotal hernia. In the umbilical hernias, they're polygenic, so it's hard to say. If you're working with a breeder by chance, I often recommend just spraying the umbilical area with iodine after they're born, you know, trimming back the umbilicus to, you know, about 10 centimeters, and trying to avoid any sort of infection around the umbilical area. But that's usually what happens, and they develop polycystic abscesses we talked about before, and then they just get larger and larger. So if you're going to be doing this surgery, just keep in the back of your mind, you may not be dealing with a true hernia, but maybe a polycystic abscess. So just be prepared. Pig spays, boy, I did a bunch of these way back when, and they were about as hard as a cat spay. They are just amazingly straightforward, and yeah, it's easy to do, really. So all you have to remember is that they have a lot of vascularization in the broad ligament, a whole lot more than in dogs and cats. So you'll be doing a bit of tying off, to say the least. You may be spaying a pig. Those of you that are brave enough, if it's an older pig and it may have a tumor, you know, there's going to be a larger vascular supply and to that, so it's going to be a bit of work. Oh, this is talking about 2-ochromic. I think that's probably an old slide. You can use Vicryl PDS, whatever you like. You know, it's they're not hard to do, and if we don't spay them, if somebody gets a small female pig, I would certainly very much encourage them to get spayed, because unspayed females can develop cystic endometrial hyperplasia, leiomyomas, leiomyosarcomas. They don't tend to get pyometra, but occasionally it's been reported. And it's really common in animals that have never had a litter and they're getting older. And earlier on in my career, I didn't recognize this as such, so you can learn from my mistakes, but the vaginal bleeding was actually reported the most of anything. Was that jeepers, like she's bleeding again, and I don't think she's been bred by anybody because all the boys are in a different pen, and and it was probably at least cystic endometrial hyperplasia, if not something worse happening on that pig. Obviously, if it's a tumor abdominal distension, they can get quite large, and they may or may not be anorexic. So, and adenocarcinomas are common in aged females if they're going to have a tumor. That's where you're going to see it. So, spay them when they're young. It's easier to do. They're a lot less fat, and it's a lot more straightforward. So I took a bunch of photos of, I didn't, I had somebody hold my camera and take photos of me doing a pig spay. And as I said, unfortunately you can't orient yourself here, but you're pretty close to being between the hind legs almost, kind of like with a cat. And much like with a cat, once you've gone through the skin and the muscular layers, that uterus, even in an immature pig, is just sitting there. It's just right on top of the bladder, just like a cat. It's just like, pick me. You don't have to go hunting for it like those deep-chested dogs that drive you crazy. It's right. Look at that little curly thing. I know I'm getting excited, but I mean, pig spays were just pretty neat. At any rate, so they're very curly. This is a mature pig. I can tell because the uterus is larger. It's quite tortuous, I guess, almost. You can see, there you go. It's also because this pig is ovulated. And so you can see the ovary right there. So basically exteriorize it, and then, you start tying off all the blood vessels, which probably it gets a little bit boring, but tie them all off. The pig uterus has quite a long cervix on it. So, you want to be just sort of aware of that. That's okay because, they also, obviously, there's lots of room to carry the babies in. There's these big horns. You can see all my busyness and tying things off. I have a million hemostats going. And then we're ligating here, something or other. I can't tell what I'm doing anymore. And then just going through the remainder of there we are. We're going after the cervix now, tying off, and then I always do an oversew on it as well. And back we go. And I never leave skin sutures in. I always do a subcuticular. Why? Well, it's just easier. The pig is pretty stressed from coming to the clinic, and I think if you don't have to ask it to return, the owner's happy and the pig's happy. And as well, if they're a pig that's living or going to be living outside in a barn, I've sealed the skin surface, and I don't have to go looking for suture material or any gapping in between. It's a preference, and it's my preference, and it's always worked for me. So I'll leave that with you folks. Yeah. So pet pig problems, the other thing that they come in for once in a while. And so we've already addressed the cystic endometrial hyperplasia at the bottom, but there's a few photos and things we can talk about. So I'll just go through sort of like pick the high spots here, erysipelas and whatnot, and go through it. So usually when you are called by somebody and the pig is just sick, it's sick, it feels warm. If it's a black pig, you're really not going to see these raised red lesions, which is caused by the erysipelas organism. And just so you know as well, erysipelas is carried in the tonsils of about 30% of swine. I'm not sure if anybody's done this study in miniature pigs, pet pigs, but I don't think there'd be a whole lot of difference. So you get these raised sort of rhomboid lesions on them, and they have a fever. They are some sick. They just feel ugly. But the best thing about erysipelas is you're an instant hero because it responds really nicely to penicillin. Just plain old penicillin. You can give an injection if you want, but if they're not feeling really good, then you're seriously annoying them with that too. But you can certainly just go with banana flavored amoxicillin, get the kid stuff in, couple times a day. If they're really sick and you're really worried, you can give them an injection, and also an anti-inflammatory as well. And it's really important to treat it, because the consequences of untreated erysipelas are arthritic lesions, or endocarditis, valvular endocarditis. So it is important. Now, in a black pig, you can actually feel the bumps, these raised bumps on them. And like, as I said, they'll have quite a high fever. It was pointed out to me by the lady that ran the sanctuary. We had a couple pigs that had manifested erysipelas and were treated, and they'll have bleaching actually of the skin. So these spots here aren't bite wounds or scratches or whatever. It's actually post-erysipelas bleaching of the skin, and they have them forever. So you may see that on a black pig. One of the probably the most upsetting situations in a pig is called dippity, and I have no idea why it's called dippity, but the formal name of it is erythema multiforme. And still unknown causes. We actually do see this occasionally in domestic swine, in young pigs. Not so, maybe on the sow, early nursery. I don't think I've seen it, but I actually haven't gone looking for it either. It's maybe associated with stressful situations, usually seen in pigs, in miniature pigs less than 2 years of age. The pig might hunch down on its back end. Its tail, instead of sort of waving and waggling and being really happy and curly and whatnot, is going to be tucked, jammed against its hind legs. They squeal a lot with this condition. They hurt, and they may collapse on their back legs. As it's developing, they may be really restless, exhibiting distress, and nobody knows what's going on. And then you'll have oozing of the skin, and you'll actually have fissures at times that you can see, but you can see there's quite a bit of serum coming out of this. They may pull themselves on the front legs. They don't even want to move their back legs because it's causing these fissures to open and close. They're not super deep, but boy, it sure hurts. And the skin over the lumbar area is really, really painful. It doesn't last long, which is a good thing, maybe 3 days. 24 to 72 hours, and will resolve in 2 to 3 days. And sorry, still on. I've had my headphones die before, unfortunately. Need batteries. Resolves in 2 to 3 days. Basically, all we recommend are anti-inflammatories. But I mean, aspirin is wonderful in pigs. It works like a charm. You can give them oral aspirin, and you can crush it up and put it in some juice and squirt it into their mouth and whatever. Aspirin is really satisfying in pigs because it's absorbed and distributed really nicely. One of the few species that takes it in so well. But I also put lanolin, so I use like Nivea cream. Something's got high lanolin content on it, kind of smear it over the back, soften that skin, and just maybe help it to be a little more movable if it's softening, because this skin can be like cracking and dry and sore. So I just assume that if I keep it moist, it's fine. Antibiotics, I wouldn't even bother. I don't think they do anything. And like I said, it does resolve. Used to see a lot of pigs with mange. A little less now, but every once in a while I get surprised with potbelly pigs, and see the odd one. That poor little guy in the bottom, like he's just loaded with Sarcoptes scabiei. And surprisingly, people don't recognize this. And I used to get phone calls occasionally from physicians who called me, and they were completely perplexed and said, I think I have a client with scabies, and they have a pig. And I say, yeah. And they're probably carrying it around, and they're holding it against their belly. And even though the human is not the normal host, the scabies mites will, check out the new person kind of thing, and they'll burrow, but they can't reproduce, and it's a dead end infection. But it's remarkably itchy in people as well. So I would say yes. Well, the pig needs to be treated if you're going to manage this condition, and then you can also fix the people. So, just be aware that they have sort of classically really red skin. I mean, this poor pig just looks hairy, runty, and just dreadful. I mean, it's really overloaded with mange, and you can do skin scrapings, but you can also, if they're super hairy and itchy, and or if they have an early on infection, they look like they have like little dots, like measles. But the for me, the be and all end all diagnostic tool is my fingers. And if I just scratch that pig and then they just go wild when you're scratching them, yeah, you probably got mange. So you give ivermectins, any ivermectin, 2 doses, 19 to 21 days apart. So when the next bunch of mange mites are hatching, and that's why we're catching them 21 days later. But hey, why would you inject this stuff when you can put it on bread with peanut butter? Works fine. 1 cc's per 40 kilos, 37.5 kilos, whatever, 75 pounds divided by 2.2 is. And it's fine. I mean, this stuff doesn't taste that well. If you just put ivermectin on bread, that's why I suggest using the peanut butter, and then the pig will be, much more happier with you, because ivermectin stings when you inject it. So they're having a bad enough day with mange. Don't make it any worse. I had a situation where I don't think that the ivermectin was working really well, the straight ivermectin, and I had to use Dectamax. And so I was called to see this lovely pig, and they had been struggling with it for some time. I think this was a rescue pig. They'd had it for a number of years, and I believe somebody else had looked at it prior to me coming in and done skin scrapings, and they were not diagnostic. And the pig had gone from being a loving, caring, friendly, trot around the yard with you kind of pig to just miserable and wanted to take your face off anytime you came near it. And so, when I'm looking at this pig, and these lesions don't look anything to me other than there's a bit of scraping here from scratching, and this is itchy here. But so look at this reddening, this distribution up here. It just wasn't classic. So I said, and I did some skin scrapings on a grumpy pig. That was an art, and found nothing, of course, because that's the irritating thing about sarcoptic. They just burrow, and you just have to know where they're burrowing. And I didn't know where they were burrowing. So I said, I think you've got mange. Let's go with ivermectin. She said, well, we've given it around before. And I said, well, let's go 21 days apart. And we did. And she called me back and she said, there really is no improvement. I said, I think I'm losing my mind then, because I am sure this pig has mange. So somewhere in my travels through reading stuff, I was reading about parasites becoming somewhat resistant to our antiparasiticides, which is a concern. And I said, you know what? Let's switch our ivermectin. We're going to go to one that's compounded a little bit differently, Dectamax, made by Zoetis. And we did it on bread and peanut butter sort of thing. And this bottom picture is this pig, about 6 weeks after. And it had gone back to being a really sweet and loving pig, and the world was wonderful again. So it's amazing how a behavior problem, arose out of having sort of this chronic mange infestation, which really, compared to, Junior here, who looks like, I don't know, a water rat, he's just loaded with mange. And this pig, I wouldn't consider loaded, but it sure made her miserable. So thought for the day, just be careful. And then you probably won't see this unless they've got some kind of really weird diet they're feeding their pig. But parakeratosis can resemble mange, but it's not itchy. And this is a commercial swine. And I actually read an article about a feed mixing problem and had gone for some time, and these pigs were zinc deficient, and so it still happens, but you can see it's on the lower legs here, on the neck, whatnot, but they're not itchy. So that's the difference, kind of thing. Yeah, so your ivermectins are useful for deworming. Ascarids are probably big and common, especially if you have multiple pigs. I think I do, periodic fecals and determine kind of what's going on. Pig ascarids are enormous, and they're really gross, and they gross people out. So just remind people that if they see something really long and white that looks like it's almost a snake, it's not. It's just a big fat ascarid coming out of the pig. Joke, another one that's pretty good. I like that one. Probably more of an Easter pig joke, but ham, cured. Urine is pH 5 to 6.5. They're pretty isoscenic, but they can concentrate, but usually they're pretty dilute urine. And that makes sense if, you know, they don't concentrate urine and retain water, because that's why water deprivation is an issue in these pigs. The one thing I'm going to point out here is that the pig has a sigmoid flexure, and right here. And, you know, so we know where we're going with this. We're going to have a chat about urolithiasis, and it's not quite straightforward in management because of this bad boy right here. And yeah, early on in my career as a younger vet working with these pigs, I mean, this was everybody's nightmare. Because at that time, you know, pet pigs, potbelly pigs, you know, obviously, you know, swine veterinarians didn't want to deal with them because they were pets, and small animal vets and universities struggled with them because they didn't know anything about pigs. And so this pig sort of fell into this void in the middle. And so urolithiasis way back when was essentially, if it was they were blocked, it was almost a death sentence, unless you did sort of, you know, some kind of urethrostomy and, you know, splatted it open in the back of the pig, and then they just dribbled for the rest of their life, and that's not much of a life either. But anyway, you get called and it's your worst nightmare. You know, they're struggling to urinate, and they're dribbling, and they're constantly getting up and standing over if they're in the barn in the bathroom area, or they're standing in the litter box. You can teach them to pee in a litter box in the house, and, you know, they're standing in the litter box and they're teeth grinding. And if they're teeth grinding, they're in pain. Teeth grinding can be a sign of boredom in pigs, but usually it's if they're struggling to urinate and they're getting distressed. So that sigmoid flexure precludes any hydroretropulsion. It ain't going to happen. So depending on the size of the urolith, you know, we can go with sedatives and antispasmodics. Bethanical is not recommended because just the side effects in potbelly pigs, bruxism, which is, you know, teeth grinding and colic and flatulence. So you're just making a bad problem worse. I had a vet call me working with some pigs, and an owner had a collection of potbelly pigs and lived in the barn. And this one pig he determined had you know, at least a partial blockage. It could get some urine out, but it was, you know, standing there and struggling. Although it seemed pretty cheery, so it clearly wasn't in distress at that point. And so we went with prazosin, diazepam. I think we used some acepromazine on it. Just kind of threw everything at it, and it was on a potbelly pig diet, which also has ammonium chloride in it, which is supposed to help reduce uroliths. But I just actually texted him today, and we're managing. He still has moments where he has a great stream, and then the moments where he's dribbling. So I think this little thing is rolling around. So we're hoping that with tincture of time, that calculus will gradually dissolve and go away. The other problem in the pig is these are the Cowper's glands, or bulbourethral glands. Is as you're trying to, if by some miracle you were able to even get through the sigmoid flexure, you have urethral recesses, and then the pig has got such a strange design. But anyway, there's a couple articles, percutaneous cystolithotomy. It's kind of a good read, kind of interesting. And this is a photograph from that article. So this is pretty high-tech stuff. And I'm like, yep, we don't have this in the shop here. So you can refer it, to certainly like the University of Guelph has done some of these. I think that's where this one was done. University of Montreal, maybe too. Or other clinics that are, certainly much more comfortable now working with potbelly pigs, and they can possibly have the equipment to do this. Yeah, I just love this whole lecture series, and I love especially potbelly pigs because I can put all the pig jokes in here. Yes. So arthritis, and this is, why or how they get it. Partly it's from the design of the pig, and And quite frankly, if you look at a potbelly pig and he really was going to be dinner someday, they probably didn't live to be 18 years old in their original homeland. And so much as, we develop issues as humans getting older, these pigs do as well. And so you've got this pig that's over on its knees and really struggling to walk, and, classic hunchback. And here's a pig with severe arthritis and, can only walk on its knees now. And I actually had one of those knee walkers. Went out to a client. Actually, this pig also had arthritic shoulder, or maybe an elbow here. Maybe it looks like the elbow swollen, and it was just sort of fused in place, and it just couldn't get around well at all. And I went out to see it, and it was really happy, and it was eating, and it was getting around in the yard and hanging out with its other pig friends and her dogs. And so I said, well, we'll let it have a summer, but as far as getting around in the winter time and the cold weather and whatever, I said, I think this pig is really going to struggle. And it was probably only 11 or 12 years old, but we did euthanize it late in the fall. It was losing condition at that point and really having a hard time. So again, related to conformation, obesity, like everything else, there are consequences to really enjoying your food. OCD, osteochondrosis dissecans, is not uncommon in domestic swine or in potbelly pigs. Previous traumatic injury, there's all kinds of causes. Erysipelas. So, I mean, you can try, this is probably needing to be updated because I understand and I'm not a small animal vet, I'll make that really clear, all kinds of joyous things that they're coming out with for canine, arthritis and things. So, investigate them. And I would certainly give them a shot. We have meloxicam, oral meloxicam you can give daily. Aspirin does work well, depending on the size of the pig. Like I was sort of giving human aspirin daily kind of thing. Rimadyl, Cartrophin. I mean, you look it up and see what works. Meloxicam is probably what everybody reaches for now. And if you know any pig vets, we have it compounded as an oral solution. You can maybe get some from us because it's a much more dilute solution to work with, and so that will help. The other thing you really got to remember is, if it's a house pig and it's arthritic, slippery floors, tile floors, or wooden floors versus carpeted areas. You might, you know, if you're going to make a house call for this pig, make sure they've got a carpeted walkway. I mean, that makes all the difference in the world. They'll figure it out. They'll just stay in the carpet. Pigs aren't stupid. They're going to tell you that you're the one that's apparently got some neuronal deficiencies. So, here's a pig is obviously not arthritic, but, they like the rugs. They're not going to wipe out. Yeah, Bizarro. That used to be one of my favorite cartoons to read. So, don't really see lots of pneumonias in potbelly pigs. The odd time I do, they may or may not be febrile or anorexic. Probably more rapid respiratory rates, some coughing, especially when they get up. If you can get some blood and do a white cell count, get an idea of where our pig is at. Treatment options are pretty good. I have to say, and I think I see it in the later slide, I should have put it in this before. You can get a reverse zoonosis, and we talked about that before with commercial swine, with influenza going from people to pigs. And that certainly can happen, if the household breaks with the latest version of influenza, there's a chance that the pig may pick it up as well. And it's a secondary bacteria that we're really worried about with them because they actually have small lungs for the size of their body. So they're just a little more challenged. Amoxicillin's fine. If it's a really sick pig, you can reach for tulathromycin, Draxin, or Tulavin, because it's a 7-day product. So you can, give it one injection and you've kind of got that coverage. I think if it's a really sick pig, obviously you're going to want to go daily and probably maybe start with an injectable and then go orally. I prefer oral products in non-critical pigs because it can be really difficult to re-inject a pig, especially if it's a bigger pig. We talked about influenza, being sort of zoonotic both ways. And the other thing that's not uncommon in potbelly pigs, holy cats, and we talked about this in commercial swine, is water deprivation. And people are going to, bring in this neurologic pig, and then they're quite upset. And what's happened is, they've gone away. The neighbor's supposed to take care of the pig and didn't, or forgot to refill the bowl, or whatever's happening, and this pig is gone 48 hours plus without water. So you'll have anorexia and thirst and constipation, and then CNS involvement starts. And once you get that, it's bad. And so I saw a pig once that was 5 days deprived. It was blind and head pressing by the time it came in, and that's just really bad. You can try and rehydrate them. You have to be really careful. It's very small amounts of water frequently. If you just sort of let them try and fill up, you can exacerbate the problems and not bring the pig back. You may have tonic-clonic convulsions, often, stargazing, opisthotonus, sitting down, and they just get worse with time. So you need a really good history, but salt toxicity, or water deprivation is a better term, is not, it doesn't have a really happy prognosis. Some of them may become blind and deaf, wander aimlessly. So usually when they're badly affected, they're going to die within a few days. It's quite sad. So as I said, just gradual rehydration, but it's not a great prognosis for these guys. So, and then, the topic that will arise is euthanasia of pet pigs. And why does it always seem to be that it's, a really obese pet pig that's probably got terrible arthritis, and they've asked you to euthanize it? If they're going to bring it in, if they can bring it into the clinic, it depends how big this pig is. If you can fully anesthetize it, then you can go intracardiac, but you're going to need a pretty long needle for that. You can try and find an ear vein. Like I said, I've known of vets that have found, they just use a pair of hemostats, elastic band, base to the ear, bring that ear vein up, get a little butterfly or something into it, and then, you can go with your euthanasia solution. But you got to remember that, because if you're using barbiturates, that they are fat soluble, so you're going to lose a whole ton more than you planned on, I think, regardless of which way you're doing this. So I have defaulted myself into, I sedate the pig heavily. I mean, I have them way out. I go overboard with the sedation to knock them down. And then I go intraperitoneal. I know it's fat soluble. I know it's going to take a while, but because it's somebody's pet and it's a process, and I find people have really unusual relationships with their pet pigs. And so I just, I realize we're all busy people and not everybody can do this, but it's a process, and I just make the time. I did one last year or the year before, euthanized it, and I went to Hamilton, sedated the pig. She'd had it for 16 years, and it really was just non-ambulatory anymore, and living in that. It was quite a large pig. And so I probably wound up using probably about 80 cc's of barbiturate. And so I give it 40 to start, and I kind of see, and we sit there and we talk, and it's the whole process of letting go for them. So there's nothing wrong with it. At all. It just takes more time, but everybody, they're able to sort of grieve and go through the process of parting with their animal. The odd time, I'll have somebody, like when I worked for the sanctuary, I would really sedate them, start with the IP injection, and then I'd say, "Are you okay if I go intracardiac?" The pig is like way out, totally gone, no corneal response, nothing other than it's just breathing. And she was good with that, but not everybody's comfortable with an intracardiac. And as I said, often I just found myself challenged for veins, so I've kind of defaulted to defaulted to that. And then the one thing you have to remember also is where is this pig going to go once it's deceased? They have to make arrangements. The lady in Hamilton had a couple friends that were there with her that day, which was wonderful. And they had kind of a sling made up. So we sort of rolled the pig into it. It's basically a big blanket. And four of us carried this pig outside, put it into the back of their van, and they had made arrangements with an animal cremation service to have the pig cremated. So that's one thing you really got to think about ahead of time, because it may not, if they're not bringing it to the clinic, then something has to be done with this pig, or you need help if you're going to take it back to the clinic to put it in the freezer for disposal for these people. So to kind of think ahead before you do this, it's not quite as straightforward maybe as other pets. And finally, one of my most bizarre cases, which I learned about more things about potbelly pigs. This was a rescue. He'd gone down to my sanctuary. His name was George, and about 3 months of age when he entered the sanctuary. And I got a phone call from the owner saying that his penis was protruding from the sheath and dragging on the ground at times. And this was getting into late fall, so she had to keep George in the house. She had one pig that was a house pig, but all the rest, she had actually, at the end of her tenure as a sanctuary, she had about 150 pigs. And it was marvelous. It was well set up, but that was a lot of pigs. So she just didn't really need 2 pigs in the house, but she had to keep George in so he didn't lacerate his penis on, like, frozen grass and leaves and sticks and things like that. But yeah, he had no problem peeing, that was for sure. And so when we're talking about this sigmoid flexure, and this is one thing I didn't know about till after this case, and it's always cool learning things. But we also have retractor penis muscles. And what happens in some potbelly pigs or miniature pigs is that these are underdeveloped. And so obviously the penis just sort of slides out and flops around, and they will repair themselves. This is not George. This is another photo I stole. Or it might be George, I can't remember. At any rate, so it's just sort of hanging out like that, and it's weird, and nobody's really comfortable with it, and it really should be inside. So we kind of like, tried to keep putting it back inside, but that wasn't working, obviously. So we finally brought him to the clinic, and we anesthetized George. And so I thought, well, I'll just do like a little purse string suture around the prepuce, and I'll just kind of keep the penis inside, and it's fine. But I didn't know how narrow to make this preputial opening. And so I got it wrong the first time, and the penis fell out. And so we tried again, and I was remarkably unsuccessful. I do like surgery, and I really like soft tissue surgery, but yeah, not in this situation. So the owner said, you know what? I'm just going to keep him in the house, and we'll give some tincture of time. And then at this point, we'd done our homework and realized it was a retractor penis issue, and it give it some time, and hopefully it would start to do its job. But this is the wonderful thing about clients, because a lot of times they're way smarter than I am. And so she brought in a secret weapon to work with this. And now this is a stock photo of Grandma knitting, but her secret weapon made something for George that made all the difference in the world. She made George a codpiece. And I have really, read about them in the past and whatnot, but just so you know, for all these youthful people there, that yes, people used to have cod pieces years ago, which was the flap or pouch that attached to the front of the crotch of the men's trousers, enclosing the genital area, and it may be held closed by string ties, buttons, folds, or other methods. So here you go. It's an old line I have. Everything old is new again. And so we had George's penis in this cod piece, and then we just Velcroed it over top of his back. And of course, we had 2 or 3 of these because he would pee and get them wet. But over time, firstly, we stopped the penis from being lacerated or getting hurt. And the second thing is George made a full recovery. His penis went back inside, and he joined the gang out in the farm. And finally, just so you have really interesting trivia to talk about at your next cocktail party this weekend, perhaps. We know pigs have an incredible ability of smell. And I didn't know this till I read this, but their olfactory bulb in the brain takes up 7% of the brain. The human olfactory bulb, despite the fact that I love to cook and the smell of good things, apparently only takes 0.1% of my brain. Pigs have 1,113 olfactory receptor genes. Woo! And get this, cows have 1,186. Humans have 350. But, really, wouldn't the fun be taken out of truffle hunting if we used cows? It just somehow wouldn't be the same. So, folks, that was your Potbelly Pig lecture. There is the book to go to. Christine Muzacchio, I met her at the Western Veterinary Conference. Delightful. She wrote this book. She invited me to write the chapter in reproduction, although I think she was just being nice to me. She really knows everything. So it's a great reference. You can find it on Amazon, wherever. And certainly if you are interested in potbelly pigs, I highly recommend that you add this to your shelf because it's a great reference textbook. And with that, I'm going to miss you all. Thank you all for coming weekly. For those of you that did, I hope you got something out of this. And if you have any questions, I certainly don't mind entertaining them at this point.
Well, Dr. Sue, it's Barb here. At the moment, there aren't, that I can see, questions so much in the chat as rave reviews. Like, you weren't kidding. You pulled out all the stops for the last lectures, and the ones before were excellent. But like, definitely, you got a couple of very favorable comments on the cod piece slide, I'll tell you, and you'll have fun looking at the chat after. But like, yeah, on behalf of all the rest of us, Sue, thank you so very much for the excellent lectures, and you managed to keep everybody absolutely mesmerized late afternoon, early evening. So that is not a trivial thing, and that's even before we got to all the good content. So thank you very much.
Oh, my pleasure.
I have a couple of really quick questions,
Sure.
if that's okay. And one, they're both really basic and probably kind of dumb, but so like, I was just thinking of some of the drugs that you're using on these surgeries. You don't worry at all, obviously, but these are never going into the food supply. Is that
Never.
That's just the underlying assumption?
Yeah. No,
And
they're pets. Yeah.
and OVMA, like, or however you guys are governed in the East, there's no anxiety about that, or documenting that you've discussed, keeping them out of the food supply, which could be a thing in some Western provinces, and that's why I'm asking. But
there was only one time I recalled where somebody took over somebody else's pet pig and then wound up butchering it and having it, and it got into the news, and it was just dreadful. Actually, I think that happened in BC. But no, these pigs, they're pets. They're definitely pets. I mean, you can certainly make sure that the owner understands, but I would almost be afraid to say to them, like, you do realize you can't ever eat this pig, because I think they would never come back to you as a veterinarian.
exactly.
It's a pet.
Yeah.
Yeah. So
Yeah.
yeah.
Okay, yeah, so yeah, sorry, great answer. Thank you. I will say there's one question now in the chat, Sue. So in treating erysipelas, how long do you treat one long-acting dose, or how many short-acting? I guess we're talking penicillin for a clinical case here.
Yeah, so you can just give it a shot of penicillin if that's what I mean. They're remarkably responsive to penicillin. It's just wonderful. The pig, as I said, they're remarkably unhappy about being injected. So if you wanted to hedge your bets and go with an anti-inflammatory and oral products, that's fine too. I think the pig would be happy with that. But if they're really sick, go with the injection. And 1 LA dose is good enough.
Okay, so now we've primed the pump. There are, in fact, more questions coming, which is great. So does aspirin predispose to ulcers if you use it long term?
It's a good question. I didn't see that happening with the pigs, but I think, if that certainly would be a concern, and so in which case, you want to use something else like a Metacam or something that doesn't have that side effect associated with it. But if it's sort of like, oh gosh, this pig's really bad, like they're at the cottage and suddenly it's terribly arthritic because it's rained all week or something, I mean, you can go short-term aspirin, and I have no issues with that.
Okay, great. Thank you. That's all I see in the chat. The other one I had, if it's okay, is so for your surgical pigs. I mean, you talked about spaying, you touched on the potential for doing urethrostomy, I guess, but maybe. And so these guys come home and they have, healing incisions or healing surgical sites, depending on how you do a urethrostomy in a pig. I mean, we're more used to water belly in steers out here. But anyway,
Yeah.
is it kind of a given? Do they have to go into isolation for a couple of weeks until they're healed, or how do you deal with the fact that all their buddies will want to have a good look at those incisions?
If they're in the house, no, I don't really isolate them. I mean, they're fine. They heal really rapidly, especially if you're doing a spay or a neuter in a young pig.
Right.
If they're going out to the pig pen, I mean, because they're social, they just want to be with everybody. So you'd have to, I would recommend that they just keep an eye on the incision. I mean, it's easy with pig flops over and he's sleeping. You can have a quick look, or you can bring your fork out, get the pig roll, fork the pig.
Okay, the gauntlet is thrown. Okay. Well, I think that's it for questions. So again, thank you from all of us. Thank you so much for doing such a very good job. I guess again, I'll acknowledge on behalf of CAS that both organizations are very grateful for the SCAP funding, and I noticed that thanks to Dr. Gillies has put that little barcode in the chat. So if you really wanted to weigh in and let us know how he did, and I think it will be basically glowing accounts of how you did, Dr. Sue. But anyways, there is that barcode if you wanted to take in that survey. To repeat for the very last time, then you will be receiving your CE certificates in a couple of weeks for each of the meetings that you've been able to attend live. And there'll also be a sweeper email that we'll send out with the last recording links and materials and survey barcode again. And with that, I guess, for the very last time, thank you very much, Dr. Sue. Wonderful,
pleasure.
wonderful job. And it was just a pleasure for all of us to be part of it. So thank you so much for
Thanks for
taking us by the hand.
Okay.
Bye.
Good night.
Yes, thank you, Sue. And I promise that survey only takes 2 minutes. I did it. It's in 2 minutes on your phone. So please, if a bunch of people could do it, the SCAP folks would really appreciate that. Thanks again, Sue. Really enjoyable.
pleasure.
And
All right.
thanks, Barb and Weekend for organizing this as well.
You bet. See you,
And thank
folks.
you everyone for attending and taking time of your busy schedules to learn about pigs.
Have a good evening.
Bye, folks.